Hey there, how are you doing?
Good, how are you?
Good, I'm Dr. Saylor. I'm one of the surgery residents here. I heard that Juno was not coming out of the room for us.
I'm not sure. I'm going to get her back in the car. She might be your new mascot.
Oh my gosh, these dogs can be so stubborn, which I'm sure you know about.
Beyond.
So tell me what's been going on with her.
So, so she's about 1.5 years old, born September 2023.
Mm-hmm.
Great Pyrenees, Anatolian Shepherd.
Yep.
In October, we noticed her front left leg. Is that the stifle where they said? I can't remember.
The stifle means knee.
Oh, okay. So what did she call it?
Wrist, maybe?
She called it something funny. Anyway,
Carpus?
It's totally deformed.
Okay.
And that was the initial reason why we brought her in actually back in October.
And when did you guys first notice that?
In October.
Okay.
And our vet did x-rays then and was like, yeah, it's fractured, and we immediately began giving her, and she also at that point saw, early onset hip dysplasia, arthritis.
Sure.
And she mentioned something, I believe something about maybe torn ligaments or tendons, I can't quite remember. So we began her on glucosamine injections at that point, as well as it was meloxicam at first.
Okay.
Everything she's been on, we haven't noticed anything. There's no difference.
Do you feel like she's really painful at home, or do you just notice
it's really hard to say because as a working dog, they're stoic. They're not going to show their pain. She never whimpers or anything like that. To look at that front leg, we perceive that to be, oh my God, that must hurt. She favors it somewhat, but she's still really active. She's young. She has a brother at home, so they're like polar bears at night. What I was explaining to the other doctor was that, so I do a lot of, I'm the full-time shepherd on our little hobby farm. So I spend my whole life with them. I'm blessed to be out there with them all the time. So I do a lot of touch, I call it touch therapy, where it helps me to be able to pinpoint where she might be hurting, at times. And that front, that doesn't seem to really bother her.
Yeah.
But it is the back.
The hips.
Yes, that she'll pull away or look down at me or she stops panting. So she's showing all different cues that it hurts. So I don't really. We're just like, does she appear to be in pain? That's really hard to say.
Yeah. It's hard. They're stoic dogs too.
Yeah. So we just don't know. We just don't want her to be in pain.
Right.
And so our vet. Her biggest thing was saying, that she was like, I can't re-break. When we went back in January, she redid x-rays at that point. And she's like, well, those healed.
Right.
And she's like, so I can't really break it again. And that's when she referred us, here. So we stopped those glucosamine injections. They didn't seem to be doing anything. They're very expensive.
Yeah.
And she was on the two prescriptions here, carprofen and gabapentin. They don't seem to do anything, but I stopped giving them a couple of weeks ago because she literally she would not eat her food.
Okay. Yeah.
When it was in there, so I just don't know. The meloxicam upset her stomach really bad. That's why we switched to the gabapentin.
Okay.
And that was the glucosamine injection.
Mm-hmm. Okay.
So we just don't know. We just want, I guess,
an opinion.
Yeah.
Absolutely. Honey, are you going to get up for me, or are you going to be right there? Do you think she'll be reactive if I manipulate her, or do you think she'll be okay?
She's a very sweet dog. Very, very sweet dog.
I'll just try and let her be on the floor, and then if she won't walk for us, then it's hard to see if she's lame, but if she...
I can find videos for you.
Sure, yeah, do you have some on your phone? That'll be easy for
her
to watch. Again, dogs, we're limited a little bit in what they'll do for us.
Right. Oh yeah, I got lots of videos of her. Everyone on here, I'm sorry.
Oh, you're fine.
Here's one of them playing. You don't need to hear all the music for this, but so this is her.
Okay.
That's her.
two polar bears.
Oh my God, at nighttime it's even louder.
What's their job?
They're guardians of our flock of birds, and we've got a couple of sheep.
Nice.
So I mean, you could, like, he played, but he's pretty dominant with him.
Yeah. But she doesn't seem to, she's not holding the leg up or anything like that.
Nope, and I mean, I think there'll be a point where she'll run through the fields with them too.
Okay, let me see. Hi, honey. Oh, you're a good girl.
I just wanna make sure she's not
Yeah,
suffering.
absolutely.
So what's their job? Their job is to love. Keep the coyotes away. The raccoons, foxes, wild cats.
And do you know what caused the break in the first place?
We do not, at nighttime, they're nocturnal.
Mm-hmm.
And so at nighttime, we're on 13 acres, 7 acres is fenced in. We live off of 64, so there's a lot of traffic up there.
Yeah.
And they're very, so they just stay perimeter, the property all night long. And, they do keep away the coyotes and all of the wildlife, so I'm pretty certain it was in one of their little rendezvous going.
Yeah.
And took a quick right or a quick left.
So she is a little resistant to me doing that.
Yes.
So fully extending her hips back there.
Yep.
Yeah. Hey girl, that was very brave. Will you let me look at this front? Will you lay on your side? So she doesn't seem painful
Right.
for me manipulating it right now, but just from looking at her wrist, the x-rays from your vet wouldn't open on my computer this morning, so I haven't seen them yet, but, oh, you do? No. Looking at that, it looks consistent with a growth plate injury.
Yeah, we were wondering if maybe that was the issues that she was having, she went through a big growth spurt. I don't know which one you wanna see, there's the next one. You can still
See her
check.
wrist ones. Are you still looking like this? And were these taken
January.
And have y'all noticed that her wrist has more of that bowed appearance since then?
Yes.
So what can commonly happen is they can injure this growth plate. So this is her radius, this is her ulna, her forearm bones. What can happen is that they can damage their ulnar growth plate, but the radius and the ulna are stuck together. So if the ulna stops growing, the radius is still gonna continue growing, but it can't grow lengthwise.
Okay.
And so what happens is they'll get this bowed appearance because the radius ends up growing in more of a curved way because it can't grow straight.
Right.
So my suspicion, based off of at least looking at these, is that she injured this growth plate. This growth plate stayed open and grew in an abnormal way. So the question is, what does that mean for her? And typically what that means is that they're gonna bear weight abnormally through their wrist and through their elbow. So when they walk, if their forearm muscle or bones aren't normal, it makes them shift their weight. When they bear weight abnormally, especially in high impact activity like she does, they'll get cartilage injury in their elbow and their wrist over time. Hey, hon. She doesn't seem to be reactive in her
Right.
wrist right now, so I don't think she's done anything to like really hurt the cartilage in her wrist as of now. But in the future, she probably will be sore in her wrist, and that can limit their ability to be really active. Can I see if you're uncomfortable in your elbow? Doesn't seem like it. I know you're being good. Yeah, she's not painful in her elbow at all. But I think that she will get painful in her wrist. Just gonna take a picture of her. You can put it in her. Hey, honey. Yeah, you're a good girl. Here, the other side. In terms of what we can do for that, we would need to take our own x-rays and probably do a CT scan to fully assess how her bone has grown abnormally and determine if there's anything we can do from a surgical perspective to address it. What that would look like would probably be similar to like what your vet said, where you're kind of re-breaking the bone and resetting it so that it's more straight. The goal of that would be to preserve the cartilage in her wrist, make her bear weight in a more normal fashion so that she could have more normal function long term. So that would be for the front. For the back, if her hips are really bothering her and we feel like that's really limiting her ability to do the things she wants to do at home, for a dog of this size, from a surgery perspective, we'd be talking about total hip replacements.
Oh God, yeah.
And that's a big undertaking.
Yeah.
So I typically tell people, if dogs are not, if you don't feel like it's affecting their quality of life that significantly,
Right. I don't feel good.
then it's probably not worth doing that right now.
Okay, good.
But if she gets to a point where you feel like her hips are really hindering her, and that's at the point where you don't feel like she's able to do the things
Right.
you want her to do, or she's not able to do those things, then that's really the only surgical option we have for a dog of that size.
Okay, I understand.
Cost-wise, for big dogs, so they're expensive. I think in order for us to do a x-rays and a CT scan today of her arm, that would probably run you around $1,000. If we talked about doing some sort of surgical correction on that forearm, then we're talking probably about $6,000 to $8,000. I know, it's a lot. So that's kind of generally what we could consider for her. The other option would be, if we don't feel like it affects her that much and she's a happy dog and you guys wanted to just monitor her, would be doing things like making sure she doesn't get overweight, because that's going to be the thing that hinders her the most.
Right.
She obviously is an active dog, leads an active lifestyle, so keeping her thin is really important, because extra weight on those joints is just going to hurt them further. Other things would be, you could add fish oils to her diet. Is she on a fish oil?
She is not. That's, I mean, she gets the Cosequin, not the fish oil though, I need to add that.
Yeah, I would add fish oils to her diet. Fish oils, in their mechanism that they actually work similar to the oral carprofen. Like, it actually can be effective for pain control and helping with joint health. So that would be what I would consider adding to her diet. If you're interested, you could even do something like they make joint health diets for dogs as a prescription, but for a dog of her size, it would be quite expensive to do that.
Still less than 8,000.
Right.
But
so that would be something that you could consider for her, and I can write those in our discharge paperwork, and if you're interested.
Okay.
If you put her on one of those diets, you don't have to supplement with the chondroitin and the glucosamine and
Oh,
the
okay,
fish oil.
okay, well, I definitely like to go home with that for sure, yes,
Yeah.
I would just pick that up at, my vet probably would order that, right?
Yeah, you can order it, your vet might
Maybe
have
if you do
it.
Science Diet or.
Yeah, it's
okay. JD.
do they have, yeah.
Oh.
Yeah. You can also order it on Chewy, whatever works for you. So that would be more of the medical management route.
Okay. So, yeah, I mean, well, I think, well, so we knew when we welcomed them into our life that, we knew that this is what, these big dogs, they're prone to the hip dysplasia and all of that.
Yeah.
She's just a year and a half, and she is happy. She's our baby. So, I think we're not at surgery yet,
Yeah.
And even doing, like you said, the CT scan and all of that today, I mean, if we're not gonna do surgery, is that really necessary to do?
No, it's
Okay.
not. If
Okay.
y'all are in a position where you're like, that's just not feasible for us, don't spend
It's
the
not
money.
that it's not feasible, if we
Yeah.
needed to do these things, money is not an option, okay?
Yeah.
I mean, you know what I mean,
Sure,
money's always an option.
it's always, yeah.
But no, we will do what we need to do for her, but I'm just feeling, like today I just really, we were just surprised in January, with seeing the fracture and all of that, and then making this appointment and the big wait
Yeah.
for it, and we're like, we're just like, we just wanna know that,
Yeah.
does it need to be rebroken, or
Yeah.
something like that.
I would say from a time perspective, the hips, those can wait for years. She may be fine for years and years and years and not be affected from
Right.
them. The wrist, if you're going to consider surgery, you need to consider it sooner rather than later, because if we wait until she's already got a bunch of arthritis in her wrist, then there's not really a surgery to be done for it, if that makes
And yet,
sense.
so let me just back up.
Sure.
So you said with if you did the X-ray and the CT, that would be about 1,000.
Mm-hmm.
And then if it was determined that you needed or could do surgery on that surgery for the wrist would be 6,000 to 8,000. Yeah, shoot. I mean.
Yeah.
I
know, and I don't think she's severely affected.
I don't think so either. No, I think it's just we wanted to catch it, because she's so young. So I mean, I definitely can be more proactive, I think I will. I think I'm gonna do that. I'm gonna do that, JD or something, and we can manage that to start off with.
Okay.
And what is your take on, I didn't feel the glucosamine injections really did anything.
I think
And
a lot of
did the gabapentin or carp.
if you don't feel like she's painful at home, you don't need to give her carprofen or gabapentin.
Okay.
The glucosamine injections, a lot of the supplements that we have for dogs for joint health have mixed results from a research perspective, saying there's not a lot of research out there saying that they 100% are going to make a huge difference. So I think, sure, they might help from an early standpoint prevent the degradation of cartilage long term, but it also may just be a really expensive saline injection that you're giving her,
Right. And what is it, $80 for each vial, so it's like $160, yeah.
I think and I totally get it, if you're not seeing much of a difference and it's that expensive, what's the point?
Right.
So I think if you wanted to try something like supplementing her through her diet, then I do think that would be an effective way to try and manage her joint disease.
Okay. I think that's what I'm feeling.
Okay. All right. Well, we'll send you some discharge paperwork that just goes over a summary of what we talked about. If you have any questions or y'all talk about it at home and you want to bring her back, just let us know and we can bring her back. Do you need help getting her to the car?
Oh God, yes. We have to bring her in on a stretcher. Oh my gosh.
So she just hates the floors?
No, she is a working dog. They don't need a leash, and she does not walk on a leash. You put the leash on, and she's dead weight.
Oh, will she get up without a leash? You think in here?
She might. I don't know.
Okay.
But we just lifted her up onto the. I think they left
gurney.
They left it out here for us. No, I mean, we have to take her out to the car. We were trying to lift her up and everything.
Well, let me just go commandeer some help and we can get her outside.
Okay.
All
Sounds
right.
good. Sounds good.
Great.
Thank you so much.
You're welcome. It's nice to meet you and her.